Hey everybody, welcome back. This is a video, or rather a case that I've shared a little bit before in the past. There may be a similar video, but I wanted to touch on it again because it's really interesting. I thought it was a lot of fun to complete this procedure. So I worked previously with a group practice, and there were several dentists there. One of them completed a crown here on tooth number 18. Looks good, everything went well, start to finish, but later on the patient presented to the office with a lesion, as you can see here, around the apex of number 18, and was symptomatic. Tooth was necrotic, symptomatic lesion. Naturally, the first thing you're going to prescribe is a root canal, so one of the other dentists there completed a root canal through the crown, or looks like after removing the crown, completed the root canal. This is a master cone fit. Again, this is not my treatment. It looks like it might be a little bit long there. I'm assuming they pulled it, clipped it, put it back in. But this is the post-endo x-ray, a little bit of cement there, which hopefully was cleaned up. The post-endo x-ray here. And then this x-ray is actually several months later. So this is immediate post-endo and crown remake. And this x-ray is months later. You can see how the bone is filled in pretty significantly here around the root apex, around that bioceramic sealer, which looks like it was done really well, to be honest. I mean, the tooth responded very well. But this patient came back with a crown having come off again, this time due to recurrent decay. So I'm going to take a step backward and I'm going to make a couple of assumptions here based on what I'm seeing in this x-ray. So it looks like in the core buildup area, there's some sealer. So in my experience, anytime there's sealer mixed in with a core buildup material, that means we haven't really created a high yield bond. Now this is me assuming. I don't have any data to back that up, but I'm assuming this is sealer here in and around that core buildup material, which probably led to some sort of a bubble or just a low yield bond strength, which then predisposed the tooth potentially to developing tooth decay in the right situation. Now, whether that was the patient had poor home care or perfect home care, it's really, again, there's so many variables, it's just hard to say. But I think, having some sealer there in the core buildup area probably, at least potentially, led to some issues. So, all that being said, what I try to do when I'm completing a core buildup on a tooth is after I've seared off the extra gutta percha and packed it to make sure it's nice and dense there at the orifice, I will take a high-speed handpiece and usually a big 856025L burr and just go around the entire inside of that pulp chamber to make sure all I have to bond to is tooth structure, just dentin in the pulp chamber. And all we can see there is the gutta percha. So with that in mind, let's move forward to the next picture. Here you can see everything healed again. Recurrent decay underneath the crown. So the crown had come off. Patient returns to the office. And this is where I saw the patient. So at this point, the doctor brought me in. The doctor who completed the root canal and the previous crown brought me in. And we talked about some options. And in this case, what we opted to do was take the tooth out, excavate this little piece of gutta percha, remove that, of course, and then place a dental implant. In my experience, assuming there's no active infection and we get good primary stability, a dental implant's a great choice in most situations. Now, that's all assuming, anatomically everything looks good. So we took the tooth out. Here's a bite wing view of that tooth. Tooth came out. Here's a little bit of granulation tissue that was wrapped around the gutta percha ball. I'm sorry, this is sealer. So the sealer ball and the granulation tissue that was wrapped around it is right here. So this all came out with the tooth root, which is quite fun. You can see some measurements here. That was actually a pretty big ball, 3 or 4 millimeters wide, 5 millimeters long, 4 millimeters long, and then the granulation tissue, kind of the stringy, sticky, springy tissue there. And then we placed an implant. You can see the little outline here. This is where that sealer gutta percha ball was. We placed the implant. I think this is a good angulation. Looks like we've got enough restorative space here. And I like the positioning there, assuming we have bone on the buccal. I would assume that I would have placed a bone graft here and there, and then restored the tooth once the implant was integrated. So again, kind of an interesting case. I've named it aptly immediate implant number 18 sealer glob removal. Primarily because of this. I think this is the first time I've ever been able to remove a glob of sealer from the apex of a tooth root during a tooth extraction of this size, the glob of that size. So, moral of the story, the sealer, again, it looks like everything healed well. Probably the tooth was asymptomatic. I'm assuming here, I don't have the records in front of me. The tooth was asymptomatic, and, assuming that the top of the tooth, the crown of the tooth would have maintained its longevity, probably this tooth would have been in good shape long term. So all that being said, do your endos well, make sure the tooth is disinfected well and sealed well. Remove that extra sealer like we talked about. I'm assuming this is sealer. Make sure there's no sealer in that pulp chamber and you get a good high yield bond so there's no bacterial leakage either direction, and that'll give you a good long-term outcome. But in the event that things don't go quite perfectly, you can still end up with a nice long-term outcome with the dental implant. So, all right, thanks for watching.